So, to find out if the patient has got any excessive daytime sleepiness, it is important to rule out the possibilities of having other sleep disorders like obstructive sleep apnea, or patient has narcolepsy or idiopathic hypersomnolence, or they have parasomnias. Also look for any medical or psychiatric causes, and also review their medications to look for any medications which can cause sedation. Look for any possible potential sleep debt, whether the patient has got any sleep deprivation. All these things are important, and history can help to make a proper management plan if we can find the actual etiology which is leading to excessive daytime sleepiness. It is also important to ask about how many daytime naps the patient takes and whether these naps are refreshing. Patients with narcolepsy find even a short duration of nap of about say 20 to 30 minutes refreshing, but patients who have idiopathic hypersomnolence find that daytime naps are not refreshing, though they have an irresistible urge to have these naps. Physical findings, you usually find that they have a slow response, they have droopy eyelids, they yawn repeatedly, dark circles under the eyes, they have microsleeps during the interview. Microsleeps are basically brief periods of inattentiveness during the interview. Sleep apnea. This is absence of ventilation. So there are two major forms, which is central and obstructive sleep apnea. Obstructive sleep apnea is usually associated with snoring. It happens in N1, N2 and also in REM sleep. REM sleep you get atonia, which can lead to increased collapsibility of the upper airways. There are various questionnaires available, but unfortunately none of them take into account the upper airway abnormality or skull variations. Even though they have a high sensitivity, these scoring questionnaires have a very low specificity. Central apnea is absence of contraction of the lower respiratory muscles. This is most commonly seen after patients being started on narcotic painkillers or patients who have illicit drug abuse. It can also happen in patients who have neurological abnormalities in the brain stem. Chain stroke breathing, this is the crescendo decrescendo breathing. They manifest as both obstructive and central sleep apnea. They can be seen in heart failure, toxic metabolic encephalopathy, neurological lesions of the brain, apneic episodes, which is basically mimic chain stroke breathing, can happen after nocturnal seizures and following a stroke. Cataplexy, this is abnormal abrupt loss of muscle tone following a strong emotional and physical response. The patients experience these sort of attacks while they are hearing a joke, or there is a sudden shocking news, or they are watching TV where they come across some emotional scenes. It could be anything which triggers off these events.